So since first year we discussed general observation, so you know that the modern theory of causation of disease we discussed, as previously used to think human beings, that it is the curse of God. Then came subsequently germ theory or like that. So latest modern theory of causation of the disease, it is proved throughout the world that it is the interaction of agent, host and environment, which we usually call epidemiological triad. Epidemiological triad, you know, agent, host and environment, as it is triangulation. So there may be agent factors, means which is the causation of the disease. It may be communicable, it may be non-communicable. Suppose cholesterol may be agent, any lipid may be the agent, or again bacteria, streptococcus, staphylococcus may be the agents. Okay. Or other chemicals may be the agents, a pesticide and all those things may be agent. So that is agent. And host means our factors, our genetic factors, our day-to-day factors, tissue factors, so many factors, host as we call it. And the third is environmental factors. So environment may be directly affecting human health or indirectly affecting human health, right? So environment also agent may be in the environment, external environment, agent may be internal also, internally in our body also. Suppose, you know, from infection from the stool, Escherichia coli is there, so it causes urinary tract infection. So E. coli infection very common, very especially in females it is much more common. Why it is much more common in females? Urinary tract infection, তোমরা তো anatomy পড়েছো, আমি তো পড়িনি. Common sense? You think of inguinal region anatomy. The urethral opening and the rectal opening is very nearby in females. So especially we call it during defecation after when wash, it is better not to pass our hands from behind to front. It is from front to behind, so that that stool does not contaminate the urethral opening. It is so near. So in females, urinary tract infection is very common than males. Males also may be there. So males vary apart urethral opening than that of anus or rectal opening. Okay. So environmental. So in all of us know what is in environment hazardous. Nowadays it comes in the papers and all those things. But for medical point of view, from health point of view, from exam point of view, we have to know a bit systematically so that you can write something and all those things. So we will discuss in general, not going into the depth, not going to the particular hits regarding the environmental hazards. So at first, though we understand what do you mean by environment, but at least for, I mean, again, to writing, to say something or to elaborate it, we have to know what do you mean by environment. Everything has a scientific or other definitions, is it not? Everything in the world, though we can understand, but it has got a definition like that, or how do you define it? So environmental maybe, I always used to, so I always use in point wise. So you may write in sentence wise, but it may be write point wise. So environment may be the external factors, living or non-living. Living may be biological and all those things, and non-living other things also. There may be chemicals and other things. There may be other factors also. Dust, there may be there. Of course, in the dust there are living materials, maybe bacteria, virus, parasites may be there in the dust and all those things. So in water also directly, or maybe other things also, living, non-living. Or a physical environment, so the material or non-material, it may be something material or which we don't understand, it is non-material, all those things. So sometimes we call it, suppose air and all those things, it is non-material. This is material or like that. We describe in that way. Which surround us. So it is the external factors, maybe living or non-living, material or non-living, which influence us or which surround us. It is environment. So our environment may be usually 4 types of environment, usually. You may elaborate it. Usually 4 types of environment, like is physical environment. This is physical environment. There may be air, water, soil, housing, noise, radiation, etc. Physical environment. Or we call it the illumination, maybe an environment. Here, I mean air and all those things. In air maybe heat and cold, that may be the physical environment. In illumination maybe all this noise may be, decibel may be high. It may causes problem to your ears. People may suffer from noise induced hearing loss. Okay, we live in the urban areas or like that, suppose in Calcutta. I live very near to bypass, near Ruby. So throughout the day and night, at night also, continuous noise is there. I have to close the windows, but still maybe my noise induced, so when my noise induced hearing loss a bit early maybe than others and all those things who live in a quiet environment. It is better to live in a lower environment. All these are legislations are there that in residential areas how much noise is there. But so we are not maintaining it. For this reason we may suffer. So we call it a physical environment. There may be air, water, may be soil. In also soil, maybe so many diseases may occur due to soil. You are in the second year, so one may ask you, though it is not, we can ask you, what is the soil-borne infection? Very common, all you, huh? Very good, tetanus. So that may be the soil-borne infection and other hookworm infection. There are people defecate here and there, so hookworm may come if we enter barefooted and all those things. Tetanus very common examples, soil-borne infection. And from soil-borne other types of diseases may occur also. Air, water, soil. Housing may be an environment, proper housing. And it is said, though you are living in a, I don't know, we always call slum. Slum means in Calcutta we see slums, or Dharavi slum in Bombay, it is called the largest slum in Asia or the world. But actually, where we live, all of you us live in city areas, that is also a slum as per definition. We live in the flats and all those things in multi-stories, that is actually slum because it is not maintaining that much of criteria, we differ all those things. It is actually a slum. But usually for practical purposes, we may not call it a slum where lower socio-economic people live in the sand areas that is maybe called slum. Radiation, etc. So there may be physical environment. There may be chemical environment. As you know, the air pollutants or in water there are pollutants, in pesticides maybe these may be the pollutants, pollution, gases, exhaust, pesticides, or you see in the these winter areas, especially in urban areas, we call it smog. As now it is called Delhi. It is the most polluted city in the world now because Haryana and other Gujarat stubble burning. Stubble means, stubble ki jano to stubble? Especially এই যে ধান কাটে আগে মানুষ হাতে কাটতো, এখন হাতে কাটলে গোড়া থেকে কাটা যায়, কিন্তু এখন মেশিনে কাটে। যদি এখান দিয়ে গাড়ি করে যাও দেখবে অনেক সময় মেশিনে কাটছে। মেশিনে মানে মোর দেন 2/3 রিমেন্স ইন দ্য field. So for this reason it is very expensive again to cut it, all these things. So they burn it. So a burn causes fumes, etc., exhaust, pollution, and that comes in the Delhi area due to breeze and etc. And due to winter season, as climate is very cold, though they cannot go upwards. So Delhi is very smoggy. In Calcutta also a bit smoggy, especially in the morning hours, in the evening hours. These contains, so different types of pollution, gases, exhaust, what not, pesticides, etc. All is etc. means others may be there. There may be biological environment. Biological environment, plant, animal kingdom, biological environment, bacteria, virus, insects. You are living with the pets, that is called the biological environment. People living in the rural area with the cows and etc. and all those things, that maybe causes different types of diseases. They are transmitted. But there are some diseases which are transmitted from animals. That is called zoonotic disease. Very good. They are called zoonosis. Zoonosis is most important. Veterinary people know is, even we also know some zoonotic diseases, brucellosis and all those things, zoonotic diseases. Some call that tuberculosis also came, maybe it ardor and all those things, but it is not a bit of, that we cannot call it as exactly zoonotic disease, but brucellosis, very common disease. Leptospirosis, it is called the most important zoonotic disease in the world. Rats and rodents, through their urine, it passes. So they, from their urine, contaminated water may be contaminated. People get the disease, leptospirosis causes jaundice, liver failure, etc., etc. One of the important, very common diseases in the leptospirosis. Okay, so zoonotic disease, we may not, but in some of the, when you go in details, when in a postgraduate course, you know a bit of mode of zoonosis. But now zoonosis chapters may be there in the medicine book and all those things. From plant and animal. People handling with the cattle, they may suffer from brucellosis, etc. So many diseases. So these are called zoonotic diseases. Rabies may be called a zoonotic disease due to all these things. Social environment, very, very common nowadays, society, politics, culture, habit, occupation, income, everything has a bearing on the health. Everything. So being a community medicine expert, we have to know a bit. What is the problem going on, as community medicine is not that much neglected. So if you control all those things, your disease may be less. But problem is, we give much more importance on the when people become sick. And when people become sick, we go to the clinical departments, to the medical specialist for this reason. But if we follow the community medicine principles, if we think of it, everything as a whole, you can call the healthcare delivery system. So if we consider social environment, if we consider physical environment, that must have a bearing. Some disease may occur directly, but it may have a effect indirectly due to the environment. Okay? So suppose you suffer from some respiratory disease, but if air is contaminated, you are also inhaling it. Or your colleagues, they are always smoking. So you may not be a smoker. So passive smoking you are getting. So environment also directly, indirectly affecting your health. We are taking water here, we wash our hands, we bath. All these things, if water is not proper, water is not safe, so you may suffer from different types of diseases. Water may be chemically polluted, water may be biologically contaminated, bacteria, virus, etc., and all those things. So if we call a short note, what do you mean by environment? So you have to write by point-wise all those things. It is a material, non-material, it is a living, non-living, external factors which surrounding us. That factors may be, or that environment may be 4 types of environment: physical environment, chemical environment, biological environment, and social environment. For community medicine students, we should not forget social environment. It must have a bearing on this, all those things. As you know what is going on throughout, it is all social environment affecting health. Sometimes there are some terms you have to know, the environmental sanitation. Now, first is what do you mean by sanitation, then environmental sanitation. Sanitation is the science of safeguarding health. We call sanitation, clean, that is sanitation. We call it sanitary latrine. If latrine or bathroom is clear, it is sanitary latrine. Previously, in rural areas, when you are a child, probably you have not seen. We go to the, yes, a type of latrine may be there in the rural areas, but that is not sanitary. Because one can see the stool and all those things, though it contaminates soil, it contaminates water, etc. But the sanitary latrine, it is science developed that the sanitation is maintained in the latrines or bathrooms. But sanitation has an overall meaning. It does not only mean our physical maintenance sanitation also. It has a total meaning. So sanitation not only in your, in your family or in your flats or in your house, sanitation may be outside. Sanitation may be where we travel in the transport. Sanitation may be everywhere. Okay. So that it safeguards our health. So it is the quality of living that is expressed in the clean home, clean farm, although people, clean business where people work, business, the clean neighborhood and the clean community, total. So sanitation is the total quality of living in such that we see, suppose when we see some Western films or etc., we see that suppose most of the European cities, most of the American cities, you cannot see the very clean and all those things. There is a whole community is clean. So sanitation means not only, I have already told, not clean home, but your clean farm, agriculture area must be also, sanitary clean. The clean business where people are working, business not only where people, sorry, the clean neighborhood and the clean community. So environmental sanitation means the control of those factors You are controlling that in man's physical environment which exercise or may exercise a deleterious effect on the physical development, health and survival. So you are controlling all factors, so it cannot affect the human beings, our physical environment, which physical environment means, here physical environment by means what we can see and all those things. So everything, but it contains also biological factors, it may also contains chemical factors, etc., all those things. So coming to, I have already told you, we have to know a bit, so many, environment is very large subject and all those things, but which directly affects our health, that we have to know a bit. Our air, water or noise or a bit of radiations where people are finding. Not all things you may not be knowing, some types of biological environment you have to know on all those things. So air, very important, air and water mainly. So you have to know what are the diseases and all those things from coming from water, you have an idea. So you can, advise your patients, your community accordingly. That normal composition by volume, as you know, probably often these are taught in the schools. Sometimes it may be asked in the exams. What is the normal composition of water, air? What is the oxygen percentage? What is the nitrogen percentage? Most common component in air. Air contains several components. Normal air I am taking you, but mostly it is nitrogen. Mostly it is nitrogen, around 78%. Oxygen around 21% or like that. Carbon dioxide 0.03%. So you know, it is, if it becomes much more, carbon dioxide is very much toxic to us. It contains other gases, carbon monoxides also, water vapor, particulate matter. It is examples are given. So many oxides of nitrogen, etc., and all those things. I think all of you know when carbon dioxide is produced, when carbon monoxide is produced. Carbon monoxide is produced, CO is produced when less oxygen is available. When oxygen is plenty available, carbon dioxide is available. Which one is more dangerous, carbon monoxide or carbon dioxide? Huh? Monoxide. Why? This is your question, physiology and pathology question. Huh? কি যেটা বাইন্ডস উইথ হিমোগ্লোবিন কি তৈরি হয় বলে কার্বক্সি হিমোগ্লোবিন সো কার্বক্সি মনোক্সাইড ইজ অফেন কল্ড সাইলেন্ট কিলার তোমরা একটা বইটার নাম ভুলে যাচ্ছি মৃণাল সেনের বই ছিল খারিজ বোধহয় খারিজ মনে হয় খারিজ যে একটা ওই ফিল্মটা হয়েছিল রাত্রিবেলা শুয়ে আছে গ্রামের ঘরে ইলেকট্রিসিটি নেই ঠান্ডা সব দরজা জানালা বন্ধ ভেতরে ওই ইয়ের উনুন জ্বালিয়ে দিয়েছে কয়লার উনুন দেখেছো কয়লার উনুন কখনো দেখেছো আগে কয়লার উনুন থাকতো যে কয়লার উনুন জ্বলেছে এই কয়লার উনুন থেকে অক্সিজেনটা কম কার্বন মনোক্সাইড তৈরি হয়েছে সব মারা গেছে মানে it immediately it is very much affinity to the hemoglobin and immediately carboxy hemoglobin hemoglobin cannot pass through the vital organs, people may die. So it is called silent killer. You may not be knowing you died. Okay, so carbon monoxide is very much dangerous. So carbon dioxide also, but mainly carbon dioxide is produced much more. Carbon monoxide may be produced in particular area where less oxygen is available. Okay, so mainly nitrogen, oxygen, carbon monoxide. So you have to know not other things, at least these three parameters you have to know. Nitrogen around 78%, oxygen around 20-21% and carbon dioxide 0.03%. Impurity in air made by everything, respiration men and animals. We are respirating, animals also respirating. This causes impurity in the atmosphere. What I am breathing outside or animals breathing outside, it causes impurity. If suppose I may suffer from some diseases, cough and cold or influenza, all this, or COVID. So I am my respiration causes impurity around my surroundings. Animals also, if they suffer and all those things, they cause sometimes of diseases. Or animals, as it is called, methane gas is produced, cow dung, etc. If cow dung becomes much more, environment becomes polluted. Combustion of plants, woods, coal, gas, oil, etc. This is most important, and most of the impurity is caused by this combustion of plants, woods, coal, oil, etc., etc., all those things, throughout the gas, oil, etc. Decomposition of organic matter. Any type of organic matters decomposed, or people going to the defecation outside, the stool also may be there, or animal bodies and all those things, they are decomposing on all those things, it causes tremendous. So any organic matter which is decomposing, it causes impurity to the air. Industrial manufacturing process, and again one of the important causes. If industry becomes more, industry influence and all those things, vehicles, even vehicles, trade and traffic. Traffic also very important. Plenty of vehicles now in the urban areas, they are causing vehicular exhaust. These vehicular exhaust causes air pollution. Okay. So air may be, how air is become polluted, how air becomes impure. Sir, air may be become impure due to the respiration of man and animals, due to the combustion of plants, woods, coal, oil, etc., etc., due to the decomposition of organic matter, or industrial manufacturing process and traffics and any type of work. So always people work on all those things. That is, as it is often said, that human beings are causing pollution in the community, in the world. It is called, there is in the news you see, there is a climate conference, probably every year or so. This year also it was held. So every country represents there. There are different types of acts is there. You can, but they are fighting. America is causing, you are causing more influence, we are causing, they are causing more pollution. So you have to act like that. So all these things, the human beings are causing mainly these types of pollution. So air becomes impaired by these 1, 2, 3, 4, 5. Other factors are also there, but mainly all these things. In trade, here it is not written. Agricultural, we are using pesticides also. That also causes impurity of the air. So for this reason, in common sense, it is trade, it is liquor, all these things. It is often said, though industrial manufacturing, by industry, often it is called the big plants and factories. But do you know what is the largest industry in the community is called? Which is the largest industry? By industry, we often call agriculture is the largest industry. Agriculture is also occupation. So agriculture is a large industry, but it is not controlled by, it is controlled by self, people and all those things. It is not organized. Suppose rail industry, steel industry, or shipyard industry, or coal, mines, etc. So it is human beings, but it is a large industry. It does not have a control. It also causing pollution. So by industry means not only factory plants, agriculture also industry. They use different types of pesticides, all those things, different types of char, etc., all those things. So often it is called air pollution. Air pollution is the second highest risk factors of non-communicable diseases. It is the second large risk factor of non-communicable diseases, air pollution causes. Okay, and air pollution is one of the greatest environmental risks to health. By reducing air pollution levels, countries can reduce the burden of disease from stroke, heart disease, lung cancer, both chronic and acute respiratory disease, including asthma. So don't think that the people suffering from cardiovascular diseases, cancers, etc., different non-communicable diseases, it is caused by the people, but it also causes by the community air pollution. Very important role. Be directly or indirectly. You are probably you are smoking, that you can control, but you cannot control by yourself industrial processes, vehicular pollution, and all those things. You cannot control. That only done by a large scale, maybe by government, maybe other agencies or like that, or international action or national action, etc., like that. So for this reason, it is called air pollution is one of the greatest environmental risk to human health. So if you reduce air pollution, so many diseases can reduce. That different types of brain strokes, etc. nowadays called. Nowadays it is something is written, but it is said that air pollution is also causing low birth weight. Air pollution is also causing stillbirth. Air pollution very much dangerous. Okay, so but here some important common things written. But air pollution may cause any type of. It is called now growth of the children, that is also affected by air pollution. Okay, because people are suffering already exposed to different types of agent factors. It is also indirectly or directly affecting by air pollution, etc. 99% of world's population living in places where the WHO air quality guidelines are not met. So you see, 99% of the world population where air quality standard, air quality index every day comes in the newspapers. What is it? Suppose in Delhi now air quality index around 1000. So if it is called, if it is more than 50 or more than 100, it is dangerous. It should be below, some say that it is below 100 air quality index, some cause it is a 50 or below air quality index. But so, you see, not only that Western people, but Western people may be less. It is maybe in the developing countries like us, that Asian countries, African countries, etc. But if you see the whole world, 99% in the risk of where air quality, WHO air quality standards are not maintained. Sources of air pollution, all these things to know. If you know point-wise, you can write a bit more. So automobile is very important nowadays. Industries, I have already told you. Domestic sources also causes air pollution. Because if we, for this it is called people using, we call it now gas, cooking gas is available, LPG and all those things. But previously people used to, even in rural areas, আমাদের এখানে যে রান্না হচ্ছে বা যেটা রান্না হচ্ছে বাই কাঠ, ইট কজেস বাই কাঠের রান্না, সো পিপল ইউজ টু, গ্রামের লোক বলে কাঠের রান্না খুব ভালো, হেলদি, ইট ইজ নট হেলদি, এটার কোনো নেই হেলদি, বাট হোয়েন পিপল ইউজিং, উই ইউজ ইন আওয়ার এরিয়াজ মাইক্রো ওভেন্স or other things or gases, so it causes less air pollution, but that also causes, but lesser than, I mean coal combustion or wood combustion, etc. Domestic sources. Miscellaneous maybe pesticide spraying, as I have already told you in the agricultural field. Burning refuse, if you burn that I have already stubble burning going on, which causes Delhi pollution, etc. Even in areas also like us, burning refuse or stubble. Incinerators, where I mean these refuse and all those things, or it is used at hospital waste and other things, incineration is going on. But it again, exhaust is coming out, it causes incineration. House construction and repairing, it causes air pollution. Plenty of dust is there. আগে তৈরি হতো, তোমরা এখন দেখবে, এখন কলকাতায় বড় বড় বিল্ডিং যখন হচ্ছে একটা কার্টেন ঝুলিয়ে দেয়, ওরা ভেতরে কাজ করে এই ওয়াল থেকে বাইরের দিকে, যাতে ডাস্টগুলো একটু কম ওদিকে যায়। But again, house construction and repairing, these causes tremendous air pollution. Windborne, wind also causes spreads and all those things, breeze, etc. that causes air pollution. So common air pollutants, maybe I already told you, carbon monoxide, a bit, something you have to remember, all those things, carbon monoxide, oxides of nitrogen, very common, NO2s, etc., oxides of nitrogen. You have heard of greenhouse effects. Why call it greenhouse? Common sense, এগুলো কিন্তু বইতে নেই, আমরা কমন সেন্স। গ্রিন হাউস কাদের বলো? গ্রিন হাউস কোনটা দেখেছো কোনোদিন? গ্রিন হাউস কোথায়? শীতের দেশে আমাদের দার্জিলিং গেলেও এখনো আছে, কম আছে। আগে বিখ্যাত বনেদি ফ্যামিলিজ বা কলকাতায়ও জমিদার বাড়ি টাড়িতে থাকতো, কি হতো, একটা গ্লাস, দ্য হোল room or maybe big rooms made of glass. Why glass? And there plants are there. এখনো আছে, অনেক নার্সারিতে আছে, কম। What happens? The sun rays enters it and it causes heating environment. But so heating environment, it does not come out, all these things. So these plants and all those things, they I mean exhales carbon dioxide. Accumulation of carbon dioxide is very there. So that means greenhouse, it is called greenhouse because there are plants and all those things going on. So why it is called greenhouse effect? Greenhouse, দেখবে এগুলো কমন সেন্স, দেখবে ছোটবেলায় দেখবে দাদু দাদিরা বলতো আজকে মেঘলা হয়েছে, মেঘলা হলে কিন্তু শীতটা কম পড়ে। কেন পড়ে বলতো? কমন সেন্স। মেঘলা যদিও মনে হচ্ছে তোমার সানরেজ আসছে না, কিন্তু শীতটা ঠান্ডাটা কম, বিকজ থ্রু আউট দ্য ডে দ্য আর্থ gains heat from the sun, and at night earth radiates heat. It radiates to the upper atmosphere and all those things. So if these gases is made of all greenhouse gases and all those things becomes much more and all those things, it causes a type of blanket throughout the earth in the lower atmosphere or middle atmosphere like that. So earth cannot radiate its heat to the outside. So it a bit hot environment. So greenhouse effects means these oxides of nitrogen, mainly carbon dioxide, these accumulates through at the atmosphere of the earth. So it causes all those things, it does not all those things. So these causes different types of, it causes a blanket type effect. So it is called greenhouse, that earth become a greenhouse or like that. Sulfur dioxide also may be there. Hydrocarbons may be, polycyclic aromatic hydrocarbons or etc. Oh, sorry. Polycyclic aromatic hydrocarbons, heavy metals, lead, cadmium, etc. Maybe. These are examples, but any type of heavy metals may be there. Hydrogen sulfide, mainly produced, যেটা ওই পচা ডিমের মতো গন্ধ, hydrogen sulfide. It means the manholes and etc. People entering to wash it, they die sometimes due to hydrogen sulfide. Ozone, very important, ozone. But nowadays ozone and all those things a bit less. But ozone is also may be produced in different types of industrial processes or other things. Carbon dioxide also it is written. Particulate matters. The particulate matters, sulfates, nitrates, etc., all those things. Probably you have seen the, it is called particulate matter that is detected in the environment, all those things. In the newspaper it is comes less than 10 millimeter size, less than 5 millimeter size. Not millimeter, micrometer. Micrometer is 1 micron, 1,000th of a millimeter is called micron. It is said that less than 5 micron particulates or dust, it entered the alveoli. It causes health problems or respiratory diseases. More than 5 micron size in the upper respiratory system. So for this reason, if you see when you sneeze and other things, especially after coming from a dusty environment, if you see sometimes your this sputum or sneeze material may be a bit of blackish and all those things because these dust are coming out. Okay, so for this reason, so many, nature has given so many cilia, hair, nasal secretions, etc. because to the dust accumulation, people all those things. Nature is the best guide. যেটা নেচার বলে, কেউ ভগবান বলে, কেউ বিধাতা বলে, যে এটা আমাদের তৈরি করেছে. Always preventing all those things. The nasal area, nasal secretions, nasal hair, ciliary action and all those things due to the, it prevents different types of disease. So these are the common, but plenty are there. So at least if you name something, so the polluted air. So air pollution comes, a question, you have to write everything. What is the normal composition? How it may become polluted? What are the different pollutant methods? In what processes it becomes? So you will know all these things. So if we know how it is polluted, how it is contaminated, what are the different types of pollutant, we can take action. So preventive and control action will be accordingly. But the water often there is a short note often comes or it may be asked. That call, what do you mean by potable water? Potable, not portable, P-O-R-T. Portable means which can be carried, port. যেটা often তোমাদের obstetrics আছে, it is not antenatal care, A-N-T-I, it is not anti. Anti means against, it is ante, A-N-T-E. But pronunciation may be antenatal and all those things. Ante, natal means delivery, ante means before, postnatal means after. So again, potable water. So potable water means it is safe and wholesome water, which we drink, which we should drink. Whether it is potable or not, that is separate question. Okay, so it must be free from pathogen. So what is safe and wholesome water, or drinking water, safe drinking water? That is, sir, safe drinking water is the safe and wholesome water, which is usually called potable water scientifically, and it must be, its characteristics may be, it must be free from pathogenic, any type of pathogenic agents, it should not be there. It is said that we use different types of machines now, AquaGuard, etc., or different types of companies. So they are free from pathogenic agents and others should be others. It must be free from harmful chemical agents. chemical. Water is contaminated by different chemical agents. People are using pesticides, etc., so many things, insecticides, or water may be contaminated. It must be pleasant to taste. Though the unpleasant people will not drink, so it must be pleasant to taste. And it is usable for domestic purposes, properly usable for domestic purposes. So, safe and it is the criteria. So, if a short note comes, you have to elaborate on these points. That potable water is the safe and wholesome drinking water, which must be free from pathogenic agents, it harmful chemical agents, chemical substances, etc., etc. It must be pleasant to taste. Very important, pleasant to taste. Amader pleasant taste is very important. Amar jodi khabarta pleasant na hoy amra khabo na. Ejonno dekhbe onek shomoy আমি যদিও প্র্যাকটিস করিনি কোনোদিন, অনেক ডাক্তারের কাছে মায়েরা আসে, ইয়ং মায়েরা, আজকালকার মায়েরা, দ্য সো কল্ড আই শুড সে আরবান মাদার্স, প্রথম বাচ্চা হয়েছে, স্যার আমার বাচ্চা তো কিছুই খায় না, বড় হয়েছে, তা মাছ খায় না, নলদস্তি খায় না। কিন্তু আমরা আইডিয়াল ডক্টর হয়ে বলবে ও ভালো করে চটকে টটকে আপনি একটু নুন দিয়ে দেখেছেন, নুন দেবে, নুন দিতে, বাচ্চাদেরও একটা টেস্ট আছে। আমরা মনে করি বাচ্চা প্রথম টু স্টার্ট উইথ হয়তো নুন ঝাল খাবে না, কিন্তু আস্তে যখন বড় হবে তাকে একটু ঝাল অ্যাড করতে হবে। তুমি যেমন একটু লঙ্কা খাও, লঙ্কা না হলে ঝাল না হলে পছন্দ হবে না। তো বাচ্চারও কিন্তু সেরকম প্লিজেন্ট চাই, টেস্ট চাই, তো সেই জন্য বাচ্চা খায় না। তাকে ছোটোবেলার থেকে মাছ খাওয়ানো হয়নি বলে সে মাছ খায় না, মাছ তো খেয়ে না, টেস্ট নিয়ে থেকেও জন্মগ্রহণ করে না, কারণ মা তো বিজি, মাকে কাজে যেতে হবে, মা হয়তো টিভিতে সিরিয়াল দেখতে হবে, কন্টিনিউয়াস আজকাল সিরিয়াল আছে, মানে সিরিয়াল আমাদের মহিলাদের যে কি সর্বনাশ করছে, স্পেশালি বাংলা সিরিয়ালসগুলো, তো সেগুলো দেখতে হবে। তো ওই দেখার জন্য সে তার টাইম নেই, তো মাছ তার তো খুঁড়তে হবে, কাঁটানার থাকলে চলবে না। ডিম খাওয়ানো ইজি, চিকেন খাওয়ানো ইজি, চিকেন খাওয়াচ্ছে, সে বাচ্চা জীবনে আর মাছই খাওয়া শিখলো না। তো যেরকম লাইক দ্যাট, ওদেরও প্লিজেন্ট, সেরকম প্লিজেন্ট, এভরিথিং ইজ প্লিজেন্ট। আমাদেরও খাবার দাবার যদি টেস্টি না হয় আমরা কি খাবো? খাবো না। লাইক দ্যাট ইজ টেস্টি, বাট টেস্টি আবার বেশি হলে আবার ক্ষতি হয়। যেমন যা ফুড হুইচ কন্টেইনস মাচ মোর অফ ফ্যাট, স্যাচুরেটেড ফ্যাট, ইট ইজ ভেরি টেস্টি, বাট সেটা ফাস্ট ফুড অ্যান্ড অল দিস থিংস দ্যাট কজেস হার্মফুল, সো সেটা আবার বুঝতে হবে। ওকে, সো দিস ইজ সেফ অ্যান্ড হোলসাম ওয়াটার, আনবল। So polluted water means water is said to be polluted, contaminated when it does not fulfill the above criteria. তাহলে polluted কাকে বলবে? Which is not safe and wholesome, that is polluted water, common sense. That might be it is contaminated by different types or other types of pollutants. সেটা আমরা একটু হয়তো একটু জেনে নেব। So often it is called, some terms are there, এটাও শর্ট নোট টট নোট অনেক সময় আসে, ওয়াটার বর্ন ডিজিজ অর ওয়াটার রিলেটেড ডিজিজ। আমি ওয়াটার রিলেটেড ডিজিজটা পছন্দ করি, অনেক বই তো আছে ওয়াটার রিলেটেড ডিজিজ, বিকজ related to water, but if you comes waterborne disease তাহলে তোমার একই লিখতে হবে। ইউজুয়ালি ডিউ টু দ্য বায়োলজিক্যাল এজেন্টস, যেটা ডিজিজ ওয়াটার কন্টামিনেট হয় এবং বায়োলজিক্যাল এজেন্টস বা বায়োলজিক্যাল কন্টামিনেন্টস, তাকে ইউজুয়ালি ওয়াটারবর্ন ডিজিজ বলে। বাট ওয়াটারবর্ন ডিজিজ তুমি ওয়াটার রিলেটেড ডিজিজ একই লিখলে কোনো অসুবিধা নেই, কেউ নাম্বার কাটবে না, দেবে, অল দিস থিংস। বাট ইউজুয়ালি বা সাইন্টিফিক্যালি তো অনেক কিছু জানতে হয়, যেটা আমরা বলি না ম্যাটারনাল মর্টালিটি রেট, অ্যাকচুয়ালি ইট ইজ নট ম্যাটারনাল মর্টালিটি, ইট ইজ ম্যাটারনাল মর্টালিটি রেশিও। আমি অনেকবার বলেছি ম্যাটারনাল মর্টালিটি রেশিও, আমরা মিন করছি ম্যাটারনাল মর্টালিটি রেশিও, সেটাই সারা পৃথিবীতে রিপোর্টে যাচ্ছে, কিন্তু আমরা অফেন কল্ড ইজ ম্যাটারনাল মর্টালিটি রেট। ডে টু ডে তো আমরা অনেক কিছু বলি ভুলভাল, একটু বলি, আমাদের এজ জিজ্ঞেস করলেও আমরা ভুল বলি অনেক সময়। আমি এটা ভেরি কমন, আমি এটা বলি বিকজ আমাদের স্ট্যাটিস্টিক্সে যখন বলি যে আমার বয়স যদি 10 বছর 11 মাস হয়, আমার ইয়ার কিন্তু 10 বছর, 10 ইয়ার্স। বাট আমরা, আপনার বাচ্চার বয়স কত? হ্যাঁ এখন 11 চলছে, 11 চলে বলে কিছু নেই, যখন 10 বছর 12 মাস হয়ে যাবে তখন সে 11 ইয়ার্স। ওকে, যদি মানতে লেখা থাকে তাহলে আমি রাইট লিখবো 10 ইয়ার্স 6 মান্থস অর 10 ইয়ার্স 7 মান্থস অর লাইক দ্যাট। সো বাট ফর এনি সার্ভে পারপাস, for any statistical purpose, 10 years means 10 years 11 months, it will come in that 10 years group, then 10 like that. So due to the biological agents, the disease caused water related disease called usually waterborne disease. But again I am telling you, waterborne disease and water related disease synonymous. So biological agents caused by infective agents like bacteria, etc., etc. তোমরা জানো ব্যাকটেরিয়া থেকে disease are very common, typhoid, paratyphoid, bacillary dysentery, which causes blood dysentery, etc., or bacillary E. coli, diarrhea, etc., cholera, etc., some common things. But so many diseases may occur due to all those things. So as nowadays you see the disease, maybe cholera, diarrhea, all these things are less because most of the people are now taking a bit of safe water, a bit better than previous times and also. Viral, maybe hepatitis, diarrhea, poliomyelitis, maybe viral. Examples, maybe plenty are there. Protozoal, maybe amoebiasis, giardiasis, protozoal diseases. Helminthic, roundworm, threadworm, hydrated cyst, etc. Helminthic disease is called, আমরা কৃমি যাকে বলি বাংলায়, all the different types of roundworms, threadworms, hydrated cyst, etc., etc. I have already told you leptospiral disease. The disease is called Wells disease. Due to cause of the disease called Wells, it has a hepatocellular, it affects kidney also, different types of disease. Leptospirosis is a very large, যাই না এখন প্রেজেন্ট কমিউনিটি মেডিসিন বইতে আছে কিনা, অনেক দেওয়া আছে, এটি লার্জ ডিজিজ। So water biological agents may be infective agents, it causes infection. So bacteria, virus, protozoa, helminth, leptospira, etc. Some of the disease called by aquatic hosts, different snails, etc., etc. Suppose snail, schistosomiasis, snail, choto snails and all those things, it causes diseases. So it may cause schistosomiasis. Cyclops, again a type of slime, guinea worm disease, guinea worm disease, a bit comparatively common nowadays. It is on the verge of eradication, especially in Rajasthan and all those things. Step wells are there. Rajasthan জল পাওয়া যায় না, স্টেপ ওয়েলসের কাছে গেলে অনেকে জল নিতে যায়, বিশেষ করে মহিলা টহিলারা পায়ের মধ্যে দিয়ে ঢোকে, লাস্ট লাইক অল দোজ থিংস। তো গিনিওয়ার্ম অনেকটাই কন্ট্রোল করে এনেছে। আমি জানি না এখনও অফিসিয়ালি অ্যানাউন্সড হয়েছে কিনা যে গিনিওয়ার্ম অলসো, যেমন আমাদের যেমন পোলিও ইরাডিকেটেড আমরা বলি, স্মল পক্স ইরাডিকেটেড, গিনিওয়ার্মও বোধহয় গভর্নমেন্টের অ্যাকশন হচ্ছে গিনিওয়ার্ম ইরাডিকেশন বোধহয় অ্যানাউন্স হবে অল দিস থিংস। আমাদের আইডিয়া আছে আমরা ইন ফিউচার লেপ্রোসি অলসো ইরাডিকেট করে দেবো, অল দিস থিংস। ম্যালেরিয়া প্রথমে তোমরা জানো, ইফ ইউ গো হিস্ট্রি অফ ম্যালেরিয়া, প্রথমে ন্যাশনাল ইরাডিকেশন প্রোগ্রাম, ম্যালেরিয়া ইরাডিকেশন প্রোগ্রাম চালু হয়েছিল। তারপর দেখলো যে ইট ইজ ভেরি ডিফিকাল্ট টু ইরাডিকেট ম্যালেরিয়া নাও, এখন নামটা পাল্টে করা হচ্ছে ন্যাশনাল ম্যালেরিয়া কন্ট্রোল প্রোগ্রাম। বিকজ আমি তোমাদেরকে কন্ট্রোল, ইরাডিকেশন, অল দোজ থিংস ডিফারেন্স বলেছি। ইরাডিকেট একদম মানে ইয়েটা থাকবে না ইন দ্য এনভায়রনমেন্ট বা ইন দ্য বডি এটসেট্রা। মেবি ল্যাবে এর জন্য থাকতে পারে এজেন্টটা, বাট ইরাডিকেশন লাইক দ্য স্মল পক্স ইরাডিকেটেড, পোলিও ইরাডিকেটেড। যদিও পোলিও ইরাডিকেটেড, কিন্তু এখনও আমরা পালস পোলিও প্রোগ্রাম চালাচ্ছি, সো দ্যাট কয়েক বছর চালানোর পর হয়তো ওটাও বন্ধ হয়ে যাবে। So water related diseases due to the biological agents, two types. One may be due to the infective agents and one may be due to the aquatic host. Because some of the snails, cyclops, it remains in the water and all those things, it may causes different types of diseases. And water related disease may be other chemical pollutants, water related disease. So water may be polluted, I already told you, maybe industrial pollutants, agricultural pollutants, man-made chemical agents of diverse nature, thus causing different diseases affecting the multiple systems. Plenty of water may be contaminated. Nowadays it is said that rivers, even sea becomes chemically polluted and all those things. So it causes different types of diseases. So here I did not discuss about noise and etc., as you know, but sometimes it is maybe asked, so at least you should know for that you know noise is measured by decibels. So অনেক সময় জিজ্ঞেস করা হয় যে what is the normal decibel should be in the residential area, or what should be the normal decibel around hospitals etc. or nursing homes etc. এগুলো একটু জেনে নেবে, এর বইতে আছে। 60 এক্সাক্ট ফিগার আমার মনে নেই, বোধহয় মানে ইট ইজ লিগালাইজড, ইট ইজ কল্ড pollution control board and all those things. Usually in residential বলে less than 60 decibels or like that, or 60, 70, latest জেনে নেবে, it is in the books or in the I mean you will get in the net also and all those things. So this may be caused. Noise is also a hazard. But when you write in general environmental health hazards, you have to mention these illumination hazards, radiation hazards, etc., etc., and all those things. Okay? Radiation, I don't know whether do you know and all these things. Ultraviolet বলে কেন জানো? Ultraviolet? Why ultraviolet? আমাদের যে ভিজিবল লাইট, যেটা তুমি চোখে দেখতে পাচ্ছ, ওটা কি কম্পোজিশন কি? হ্যাঁ, ভিভ জিওর, ভেরি গুড, ভিভ জিওর। এটা তো ছোটবেলায় পড়ানো হয়েছে। ভি মিনস ভায়োলেট, ভিভ জিওর, GYOR, ভায়োলেট, ইন্ডিগো, ব্লু, গ্রিন, ইয়েলো, অরেঞ্জ, রেড। আল্ট্রাভায়োলেট মিনস স্পেকট্রাম বিলো দিস আল্ট্রাভায়োলেট। এই ভিজিবল স্পেকট্রামটাকে ইউজুয়ালি বলে, এটা চোখে আমরা দেখতে পাই, ইট ইজ 440 টু প্রবাবলি 470 or like that ন্যানোমিটার, or like that 480 না কত যেন ন্যানোমিটার। And above that, infrared, it causes heat. Infrared, there's all those things. যেটা এটাও আমরা চোখে দেখতে পাই না, এই কারণ light is also a waves. Noise is there done, it is also waves. Light is also a bit of waves, all those things. So ভিভ জিওর এদিকে আল্ট্রা, it is ultra, both are dangerous. এটাও dangerous. But a bit of ultraviolet sometimes required, but not much. As it is said that vitamin D is produced due to the action all those things. Vitamin D এর main source কিন্তু 90% source হচ্ছে সান। এ বিট অফ আল্ট্রাভায়োলেট রে স্কিনের সঙ্গে অ্যাকশন করে, সেই জন্য বলে যে ইউজুয়ালি 15 to 30 মিনিটস 10টার পরে বা 10টা থেকে এই 11টা 12টার মধ্যে যে তুমি 15 to 20 মিনিটস ইউর বেয়ার স্কান এরিয়া এক্সপোজ হয়, তাহলে ভিটামিন ডি ইউজুয়ালি ডেফিসিয়েন্সি হয় না। কিন্তু আমরা তো সবসময় ছাতা ইউজ করছি, আমরা দেখতে বাজে হয়ে যাবে, বিশেষ করে মহিলারা সানস্ক্রিন ইউজ করছি। এই যে সানস্ক্রিনের যত ওই যে কি থাকে না, তোমাদের সানস্ক্রিনে কি থাকে যেন, সানস্ক্রিন লোশনে কি এনপিএফ না কি দেখো, ইউপি, হ্যাঁ, এসপিএফ, সান প্রোটেক্টিভ ফ্যাক্টর। এসপিএফ যত বেশি হবে তত ওই লাইটটাকে প্রিভেন্ট করবে, এবং কিন্তু ভিটামিন ডি তৈরি হবে না। সো ফর দিস রিজন ভিটামিন ডি এখন বলছে যে খেতে। আবার ভিটামিন ডি ইজ ভেরি ডেঞ্জারাস বিকজ ইট ইজ ফ্যাট সলিউবল ভিটামিন। যদি এক্সেস হয় ইট কজেস টক্সিসিটি। ADEK, দিস আর ফ্যাট সলিউবল। BC এগুলো ফ্যাট সলিউবল না, এগুলো ইউরিন দিয়ে বা স্টুল দিয়ে বেরিয়ে যাবে, এটা তো থাকে না। এই জন্য ভিটামিন ডি নিয়ে একটু প্রবলেম আছে। সেই জন্য অলওয়েজ নেচার ইজ ভেরি গুড। আমরা এগুলো ভয় পাই, আর ওরা বেয়ার হয়ে শুয়ে আছে সি বিচে, ওটা স্কিনটাকে একটু ট্যান করতে চায়। ওরা বেশি সাদা তো, স্কিনটা ট্যান করলে দেখতে সুন্দর হবে, কিন্তু আলটিমেটলি ওরা ভিটামিন ডিতে করে। আবার ভিটামিন ডি আবার কালো হওয়ার জন্য আমাদের আবার স্কিন ক্যান্সারও কম হয়, বা প্রোটেক্ট করছে। মানে অনেক ব্যাপার আছে, বিকজ হচ্ছে সায়েন্স ইজ সো মাচ দ্যাট ইট কজেস অপটিমাম ওয়াজ এভরিথিং ইন দিস ওয়ার্ল্ড। তো দিস ইজ অপটিমাম অফ এভরিথিং ইজ ভেরি গুড। Optimum of sun is required, optimum of everything, all this is good. But excess of it and below of it is also dangerous. So like that, VIBGIOR, ultraviolet, infrared, etc. Infrared, তারপর microwaves, radio waves, এগুলো এই পাশে যত ন্যানোমিটার বাড়ছে, less than 440 ন্যানোমিটার is ultraviolet. ভায়োলেটের দিকে আছে সে আল্ট্রাভায়োলেট, এর কমন থিংস।